Hello everyone, welcome back to
Video,
Pharma.
we will see the pharmacological actions, mechanism of action of different drugs of NSAIDs. So here we will start with salicylates. So salicylates are the salt of salicylic acid. Example are methyl salicylate, sodium salicylate, acetyl salicylate acid, that is aspirin. So these are the salt of salicylic acid, that is methyl salicylate, sodium salicylate. These are the drugs which are used as NSAIDs. So here we will take a prototype like example, like most commonly used, that is aspirin. So we will see the aspirin of the class salicylates. Okay. So we will first see the pharmacological actions of aspirin. So pharmacological actions, first is analgesia. As you all know, it is a good analgesic. So we will see how it act as a analgesic, or what made it act as a analgesic. So aspirin is a good analgesic and inflammatory. It is a good analgesic in the sense it reduces pain and it reduces inflammation. How? We will see now. PGs are formed during inflammation. So PG is nothing but prostaglandins are formed during inflammation, and they sanitize the tissue. Sanitize in the tissue in the sense it it makes the tissue more prone to inflammation, to pain मतलब ज़्यादा पेन होता है, and that's why, and here aspirin comes and inhibit PG synthesis, and hence the pain is reduced and or the inflammation is reduced. Next is antipyretic action. In presence of fever, salicylates bring down the temperature to normal, but in normal individual there is no change in temperature. So एंटीपायरेटिक एक्शन कब दिखाता है? जब फीवर है. अगर फीवर के बिना आप ये लोगे एस्पिरिन, तो दे विल नॉट शो एनी काइंड ऑफ एक्शन. So now next is anti-inflammatory action. At higher doses of aspirin act as an anti-inflammatory agent. Signs of anti-inflammation like tenderness, swelling, erythema and pain are reduced. So at higher concentration, जब concentration ज़्यादा होता है, like dose such as 4 to 6 ग्राम per day, अगर आप इतना हायर डोज लोगे तो एस्पिरिन विल एक्ट एज ए एंटी इन्फ्लामेटरी एजेंट. सो इन्फ्लामेशन के जो साइंस है सच एज एरेथेमा, स्वेलिंग जब होता है वो, और टेंडरनेस जो मतलब क्रैम्प टाइप फील होता है, वो सब रिड्यूस हो जाएगा. We will see in respiration how aspirin acts. In therapeutic doses, that is 4 to 6 gram per day, salicylate increases the consumption of oxygen by skeletal muscles. As a result, increase in the carbon dioxide production. The increased carbon dioxide stimulates the respiratory center. So here, यहाँ पे थेरापेटिक डोजेस जब हम लोग लेते हैं एस्पिरिन का, तो सैलिसिलेट्स जो है, दैट इज एस्पिरिन, विल इंक्रीज द कंजप्शन ऑफ ऑक्सीजन, दैट इज बाय द स्केलेटल मसल. जो स्केलेटल मसल्स है वो ऑक्सीजन ज़्यादा कंज्यूम करते हैं. एज अ रिजल्ट दे विल लीव ऑफ द कार्बन डाइऑक्साइड. सो देर विल बी इंक्रीज इन द कार्बन डाइऑक्साइड इन द बॉडी, that is carbon dioxide production in the body. This will stimulate the respiratory center. So there will be hyperventilation. What? Hyperventilation. Okay. We'll see in GIT, that is gastrointestinal tract, how aspirin acts. Aspirin is a gastric irritant. Irritation of the gastric mucosa leads to epigastric distress, nausea, vomiting. It also stimulates CTZ to produce vomiting. So this here in GIT, aspirin irritates gastric mucosa, that is the lining of the stomach, and which leads to epigastric distress, meaning burning sensation, pain. It also causes nausea and vomiting. Aspirin, as it can cause vomiting, it stimulates CTZ, which causes vomiting. Is blood, even in small doses, Aspirin irreversibly inhibits platelet cyclooxygenase acetyl COX, thereby thromboxane synthesis by the platelets. So, at smaller doses also, aspirin act by irreversibly inhibiting cyclooxygenase, that is COX, and also thromboxane synthesis by the platelets. So it decreases thromboxane and platelet aggregation. The immunological effects in higher doses, salicylate suppresses and several antigen antibody reaction. At higher dose, it suppresses antigen and antibody reactions. So we will see pharmacokinetics of aspirin. Salicylates, being acidic, are rapidly absorbed from the stomach and upper small intestine. So they are rapidly, वो कहाँ से absorb होते हैं, small और stomach और small intestine से, that is more specifically upper small intestine. So next is pharmacokinetics. Salicylates, being acidic, rapidly absorbed from the stomach and upper small intestine. But aspirin as such is poorly soluble and not well absorbed. When administered as microfine particles, absorption increases. So here aspirin is acidic, or salicylate are being acidic in nature, so they are rapidly absorbed from the stomach and upper small intestine, but they are poorly soluble and hence are not well absorbed. So when they are administered as microparticles, that is smaller particles, then there is increase in the absorption. Hence the particle size, pH of the gut, solubility, and the presence of food will influence the absorption. This is the pharmacokinetic about aspirin. Next we will see the adverse effects. So first is GI tract. As we have already seen, it can cause nausea, vomiting, epigastric distress. It can also causes nephrotoxicity, that is long-term use of these NSAIDs can cause the analgesic nephrotoxicity. Then in CNS, it can cause headache, dizziness and confusion. It can also cause allergic reaction and hepatotoxicity and bronchial asthma. So these are the adverse effects. Contraindications. Rare syndrome seen in children in the form of hepatic encephalopathy, which may be fatal. It develops a few days after a viral infection. So there is the Rare syndrome in children, which is a contraindication for analgesia. And in pregnancy, aspirin when taken at a term delays the onset of labor due to inhibition of PG synthesis. PGs play an important role in initiation of labor. So in aspirin, when aspirin is taken by a pregnant woman, there is delay of labor due to inhibition of PG synthesis. There is inhibition of PG synthesis, and due to which there is delay in labor, premature closure of ducts, arterials may be in the fetus, resulting in portal.